So I guess the first question would be, what is mental health? So mental health is our emotional and psychological well-being. So it's very much an internal process, which also affects our external, our behavior, which we will come to later. But good mental health is described as the ability to cope with the normal stresses in life, to be able to work productively, to be able to contribute to our community. So this is the definition that's given by the World Health Organization. So what do we mean by like normal stresses of life? Life in general, there are many stresses. People who say that they don't encounter any is probably not telling the truth, but there's a lot of stress that we come across in life, and good mental health is the ability to be able to cope with it. So we can think of mental health as like on a continuum, right? So it's not just good mental health or bad mental health. It's like we range between different levels during our lifespan. So we vary in this position during a lifetime. So for example, maybe, you know, how sometimes people say, oh, I'm having a good day, or like, you know, I'm having a good week, or then the next week I'm having a bad week. So we do fluctuate in our mental health. So for example, if we're encountering some kind of stressor, if it's work related, if it's relationship related, like those things affect our mental health. So we do fluctuate on this. And there is, it's also important to recognize the difference between a mental health problem and a mental health illness. So for example, we'll talk about major depressive disorder later, and that is a mental health illness. It's something that is diagnosable by like a doctor, by a psychologist perhaps, a psychiatrist. So these kind of like illnesses, I guess we can say, it is something that is diagnosable. So it's also important to remember that people who are going through a mental health illness, this really is the illness that is affecting them. So just because you have a mental health problem, it may not necessarily mean that you have an illness. For example, you have depression, you have anxiety, like people, like we all have mental health problems, and I think anyone who says that they don't, I think like they're probably not being very honest in that sense of things. So it does affect your work, your activities, your relationships. So mental health overall, it is a very important topic, but it's often neglected, or it's not spoken about. So a major reason for this, and this is something that I understand as well, because we live in a society, a culture where it's not really spoken about. You know, there's a lot of stigma that's associated with it.